Welcome to this series entitled Novel Therapies for Bleeding Disorders, produced by the Canadian Hemophilia Society. Here's your host, David Page.
Welcome to the video podcast series entitled Novel Therapies for Bleeding Disorders, produced by the Canadian Hemophilia Society. I'm your host, David Page. The episodes explore therapies that are potentially coming to the Canadian market for the treatment of hemophilia A and B, von Willebrand disease, and other rare bleeding disorders. Our guide to these new therapies is Dr. Roy KHALIFÉ, assistant professor at the University of Ottawa and co-director of the Ottawa Regional Adult Bleeding Disorders Program at the Ottawa Hospital. This video podcast will explore therapies that may become available in the future to treat people with von Willebrand disease and Glanzmann Thrombasthenia, conditions that have not benefited from clinical research advances to the same degree as hemophilia A and B, at least until now. Welcome, Dr. KHALIFÉ.
Good morning, David, and thank you for the invitation for having me today.
Could you tell the audience a little bit more about yourself?
For sure, yes. I'm a hematologist in Ottawa, and I treat adult patients. So my clinical work is primarily focused on bleeding disorders and many other rare diseases in hematology. So excited to be talking about new therapies or exciting new therapies in bleeding disorders,
especially for von Willebrand disease. As you know, as I said in the introduction, we've seen lots of great advances in gene therapy and clotting factor concentrates for hemophilia A and B, but not so much for von Willebrand disease. But they seem to be coming now. Could you tell us about one of the most promising, VGA-039? You're
correct. I mean, for decades we focused on treating bleeding disorders mostly by replacing what's missing. So giving factor 8 for hemophilia A, giving factor 9 for hemophilia B, and von Willebrand factor. And we haven't paid as much attention as to von Willebrand factor and von Willebrand disease, partly maybe because it's such a complicated protein. Yet one of the most common bleeding disorder condition that we deal with. So VGA-039, which hopefully eventually will have a different name that we can hopefully pronounce as well, but it's still an experimental medication. It's designed to help the blood clot. It's designed to help your body clot, not by adding clotting factor, but by dialing down the body's natural anti-clotting system. So if you think of clotting like a car, your gas pedal is the clotting factors, and then the brakes are your natural anticoagulants that prevent you from clotting too much. And people with bleeding disorders don't have enough gas. And what VGA-039 does, it works by loosening the brakes instead. So this specific medication blocks a protein called protein S. And protein S normally helps by slowing down or it's slow clotting in two important ways. It helps another protein, which is protein C, shut down clotting factor. And it also helps, so protein S also helps clotting from starting too early. It prevents clotting from starting too early. So this is the two ways that this works. And by partially blocking protein S, what VGA-039 does, it allows the body to make more thrombin, which is a very important protein, to stabilize a clot and form a clot and stabilize it.
So this is now in clinical trials, and so we've seen some evidence about its benefits, how efficacious it is, and perhaps some evidence about any risks that it might have. Could you talk about those benefits and risks?
So I mean, what's important here is with this approach, because it doesn't depend on von Willebrand factor, it doesn't depend on factor 8 or factor 9, or theoretically, it could work in many different bleeding disorders. So hemophilia A, hemophilia B, von Willebrand disease, other rare bleeding disorders, and possibly people with inhibitors. But I'm getting ahead of myself. This is currently being studied for von Willebrand disease. As you mentioned, it's early phase clinical trials that are being conducted, really to assess its safety. But also a phase 3 clinical trial looking at the efficacy as a prophylaxis or preventative treatment to prevent bleeding in patients with any type of von Willebrand disease. So potential benefits with this agent is that it's given under the skin as an injection, and it could help reduce the need for frequent intravenous access. If it works, the hope that is it could be used for many different subtypes of von Willebrand disease and potentially work across bleeding disorders, and providing a steady background bleeding protection. Now, in early stages, this is sort of in the very early stages, so you're probably looking at 3 to 5 years before you see this agent come to market if the development continues. The main thing to keep in mind or to be looking forward from a safety perspective whenever we play around with our clotting system is the risk of clot. So that's really our biggest concern is, do you tip the balance toward clotting because you're reducing the body's natural anticoagulants. So you need to make sure that dosing has to be very precise and monitoring will be essential, especially around surgeries or breakthrough bleeding, as we also give people more von Willebrand factor or other products. So, exciting news, but still early in development. And so far, looking to be quite interesting product for von Willebrand disease.
Well, that's especially encouraging that even though it could be used in the hemophilias and perhaps other bleeding disorders, the company developing it is really focusing on von Willebrand disease. And I think there's a, real opportunity there for progress and for advances. Let's move on to another, again, early clinical trial, a product called, they have wonderful names. They're either their numbers or their other crazy names, but this one's HMB-002. And again, a potential treatment for von Willebrand disease. Could you tell us about that one?
Correct. Yeah, I can't speak to the name itself, but that's what we have so far, HMB-002. In many people with von Willebrand disease, we know that the body does make von Willebrand factor, but it gets broken down too quickly. So HMB-002 is really designed to protect what's already there, rather than replacing it. So it's an antibody that binds to your own von Willebrand factor at a specific spot, which is called the C-terminal domain. And by doing that, it shields your von Willebrand factor from being broken down. So in doing so, it helps increase your von Willebrand factor levels. It helps increase your factor 8 levels that is bound to von Willebrand factor, and therefore helps improves your body's natural ability to form clots. And this is again doing so by giving a simple under the skin injection, and being studied currently for those with type 1 von Willebrand disease, type 1C, and also type 2A von Willebrand disease.
So this is a bit different from the ones we've been talking about in VGA-039 and in previous episodes, which were rebalancing agents. This one, from what I understand from you, is not a rebalancing agent. It actually acts on the von Willebrand factor.
Correct. It is an antibody that acts directly on the von Willebrand factor. It doesn't change your clotting system, doesn't take away anything or add anything. And right now it's being studied. Well, it is a prophylactic treatment options, that is being looked at. Because the current options that we have for VWD are quite limited, especially outside of those with severe cases. So HMB-002 could be a way to prevent bleed instead of always reacting to them, and much easier to use than intravenous therapies. So less and also less reliance on products that are derived from human plasma.
Now we're talking about, I think, a phase 1 or phase 1/2 clinical trial here. How far away are we from perhaps marketing these products? How long is that process from phase 1 to, to phase 3 and then to approvals and then to marketing?
HMB-002 is still in early clinical development. So with a phase 1 and 2 clinical trial that is currently recruiting. So we are years away from access to market, and if all goes well, potentially 5 to 7 years. But this is very much dependent on if this works out well and follows the timeline, if there's no hiccups that requires either changes in protocol or suspensions of the study to investigate. And a lot of that is also dependent on our agencies in terms of reviewing that data and going through the motion of approving drugs. So optimistically, maybe 5 to 7 years, but we're still several years away.
Is there any potential for engaging in or participating in clinical trials here in Canada?
For sure. I think the Canada represent an important piece of that puzzle, and all of our treatment centers are quite engaged and would certainly be open to having clinical trials available. The reality, there's lots of complex factors that come into that, and part of it is requiring industry to go through the motion with Health Canada, with the regulators, and then opening those trials in Canada and specific centers. But then each specific center has to go through that motion as well, and opening a clinical trial. So there may be more barriers than we think of, but certainly I think it's an opportunity for pharmaceutical industry to engage with our treatment centers.
The same company that is developing HMB-002 has an HMB-001, and that's for Glanzmann Thrombasthenia, another inherited bleeding disorder. Is that somewhat similar in terms of its mode of function?
Not quite similar, but Glanzmann Thrombasthenia is it's a rare platelet disorder where your platelets can't stick together properly. We currently don't have any preventative treatment, so care is mostly reactive with exposure to platelet transfusions that runs its own risk. So the way it works, it's an antibody that acts like a delivery system. So it grabs on to your it grabs your own body's activated factor 7. And it brings it to the injured blood vessel. So it brings it to your platelets. It brings it to where your blood vessel is injured to help form a clot exactly where you need it. It's also given under the skin. So it's the same sort of mechanism of delivery, not through an intravenous injection, but works as a different medication, given that the physiology is different from in that condition. This is really exciting, as you can imagine, for a condition that we don't have much to use. And so this would be potentially the first prophylactic treatment for Glanzmann and reduce or eliminate the need for platelet transfusions and the risk of developing antibodies to platelets, which really complicate management of this condition.
Another von Willebrand treatment in the pipeline is called BT200. I guess this is a different concept altogether, isn't it?
Correct. So BT200, and I'm not going to attempt to pronounce its actual name, but BT200. So it's not a factor product. It's not a rebalancing agent. What it seemed to do is help von Willebrand factor and factor 8 last longer in your body. So it attaches to your von Willebrand factor in a way that it slows down how quickly von Willebrand factor and consequently factor 8 are cleared from your body. So it then helps raise your von Willebrand level and factor 8 level that is attached to it. This one is given as a weekly injection under the skin. So again, the theme here is these are all injections under the skin. And it has been studied for hemophilia A at across all severity of hemophilia A, as well as von Willebrand disease type 1, type 1C, and interestingly type 2B. Just to emphasize, so in type 2B, it's quite interesting. So it does something different where in this subtype, we know that platelets are often too low because the abnormal von Willebrand factor sticks to them, and then your platelets are cleared from your body. So in this context, BT200 seems to help correct that defect and restore your platelet count to normal, but also restore your von Willebrand factor multimers, the high molecular weight multimers that are important to clotting, and also increasing factor VIII levels. So it's quite interesting to see also in the different subtypes of von Willebrand disease that some molecule may be important for different types.
And there's one more for von Willebrand disease, which makes people laugh sometimes. It sounds almost too good to be true. It's called transcutaneous auricular vagal nerve stimulation. And this is not an infusion or injection at all. Can you please give us a bit more information about that one?
Right. I had to go digging a little bit into that one, but it does sound unusual. It's a therapy that doesn't involve a drug at all. So instead, it uses a wearable device that you place on the ear, and that gently stimulates the vagus nerve, which connects the brain to many organs, including the immune system and the clotting system. So very early data, and why would nerve stimulation affect bleeding? What we potentially know so far is that nerve signals can change how your platelets behave. It can reduce bleeding in soft tissues and influence your inflammation or clot formation. So in other words, your nervous system can also modulate how clotting works. This is, so far what we have is a very small pilot study. So we can't make a lot of inferences there, but it looked, so that pilot study looked at 8 women with von Willebrand disease and heavy menstrual bleeding. Participants self-administered 2 daily 1-hour session of this transcutaneous auricular vagal nerve stimulation throughout their menstruation. So far, I mean, what they've shown is that the menstrual blood losses drop by more than 50%, and the period length shortened without major side effects reported. So participants use this device basically twice daily during their periods. But again, reminder that this is a very small study. It's not randomized. It's a proof of concept to really look at doing additional or larger studies and trials. So still very exciting because it's not a drug. It's not invasive. You can potentially empower patients to manage their own conditions when they need it, and maybe very relevant for women with von Willebrand disease who don't respond to our existing options.
So when I first saw that, I thought it was Star Trek. And then my wife looked at the video and said, no, that's Chinese acupuncture. So it's Star Trek meets Chinese acupuncture.
Potentially. I mean, it has been used in other conditions. It's not necessarily new. There's been systematic reviews of over hundreds of studies and thousands of patients across various conditions that shows there's some efficacy to it, and no evidence of severe adverse events or side effects. The most common things tends to be mild localized ear pain, or headaches, or tingling because you're affecting your nerves.
The other promising thing about this is that it's not a drug. So it doesn't go through the same review process. It's actually a medical device. It's been accepted in the US, and I think the company is trying to get access here in Canada. So it's something that might be available sooner than some of the drugs we're talking about.
I would like to share your optimism. I never know how things go and with our regulators, but yes.
Since we're talking about things that are somewhat in the distant future, hopefully not too distant, A couple more that we didn't touch on in our previous episode on hemophilia A and B. And these are somewhat more advanced types of factor VIII mimetics. One is, again, a very interesting name, NXT007, smacks of James Bond, and the other one, INO8. Could you just briefly tell us about how these may improve the picture in factor VIII mimetics?
Two exciting therapies again for hemophilia A in the factor VIII mimetic under the factor VIII mimetic category. Next, or NXT007. So this is being developed as a prophylaxis for hemophilia A, both inhibitors or without inhibitors, and really the main goal is prevention of bleeding. Very similar to emicizumab, what we currently have, but engineered to generate much stronger clotting activity than what emicizumab provides you. So it potentially can reach clotting levels that are closer to those seen in people without hemophilia. It is a factor VIII mimetic, so it acts like activated factor VIII, even though it's not factor VIII, and it brings together your factor IX, your activated factor IX, and then your factor X so that your body can make a clot more effectively. It's also given as an injection under the skin, so not an intravenous injection. And currently the early studies have focused on adults, but if development continues successfully, then future studies will also include children. So why would this be of interest? It would be of interest for people who have breakthrough bleeding on emicizumab, or who may be looking at stronger and more consistent bleed protection without intravenous infusions. So far, it's still in the early clinical trials. What we do know comes mainly from laboratory and animal studies, which have shown that it can generate clotting activity similar to normal factor VIII levels. It works at much lower doses than emicizumab and produces stronger thrombin generation, which is, again, what we want to see to have a stable clot. Hopefully this means that it provides better bleeding protection in people with hemophilia, but those studies will need to come. So far, all I've seen is data from a phase 1 study in healthy volunteers. So no studies in people with hemophilia yet. And in those healthy volunteers, what they've shown is that there were no blood clots reported, no injection site reactions. There was one serious skin reaction that occurred but wasn't clearly linked to the drug. And some participants did have antibodies to the drug, which has caused it to be cleared faster from the body, but didn't cause safety problems. So we'll have to see about efficacy as we learn more about this treatment.
And when you talk to people with hemophilia and you ask them what they would like to see, often the answer is, just give me a pill. And that's the idea behind INO8, isn't it?
Correct. INO8 is a whole different ball game and being developed as a prophylaxis therapy for people with hemophilia A, but as an oral or a pill, as an oral medication or a pill. At this point, this is only obviously available through clinical trials, but not yet approved and being studied in healthy volunteers and people with hemophilia A. But it's an interesting thought or changing how we deliver treatment for those with hemophilia. It is still a type of factor VIII mimetic. It's engineered to, again, mimic the action of factor VIII, similar to emicizumab, Mim8 or NXT007. But it may be easier to use than traditional factor infusions or injectable non-factor therapies. Although I would argue if you only need to take an injection once a month, or every couple of weeks, as opposed to taking a pill every day, I don't know what people like. Every person is different, right? So for some people, they might choose to stay on an injection every couple of weeks. Others will much prefer to take a pill. Now, you have to keep in mind that whenever you take a pill, it has to go through being absorbed through your stomach, then go through your liver, and then reach to where it needs to go to do what it needs to do in your body. So this is still, again, in early clinical testing, in phase 1 testing, to look at safety and how your body processes this medication, and looking at different doses, looking at how it's absorbed, how food might affect it. So we are still a little bit of ahead of ourselves in terms of moving it into or along the clinical trials of phase 2 and phase 3 to look at efficacy.
So how do you look towards the future with, especially with regards to those, undertreated conditions like von Willebrand disease? Is it, you find it promising?
I think it's promising. I think it's exciting. I think what ties all of these therapies is choice. And the future of caring and treating people with bleeding disorder is not one best treatment, but many options on the table, and each may be suited to different lives, bodies, and priorities. So the overall aims may always be reducing treatment burden and trying to see about, therapies that work across bleeding disorders, addressing some health gaps, especially for women's health. But ultimately, I think it's really giving people choices, about what may be more important for them at some point in their life, and then what may be, efficacious, at another point of their life.
Well, thank you very much, Dr. KHALIFÉ, for telling us about these novel therapies. We hope that this podcast has succeeded in helping you understand what is an exciting, but as you heard, complicated product pipeline. To learn more about novel therapies, we invite you to explore the Novel Therapies Education Program on the Canadian Hemophilia Society website, hemophilia.ca, and tune in for other episodes in this video podcast series. Above all, for those considering a novel therapy in the future, it's important to talk to your bleeding disorder care provider or hematologist to better understand what treatment is the best option for you.
This series was made possible by unrestricted educational grants from Novo Nordisk Canada, Pfizer Canada, and Sanofi Canada to the Canadian Hemophilia Society.
Another Sound Off Media Company podcast.